Good afternoon, all. And thank you, Mr. President. The White House Coronavirus Task Force met today. We briefed the President on our latest recommendations. We continue at the President's direction to lead not a whole of government approach, but a whole of America approach. You just heard the President describe one inspiring story after another, the way the American people are responding, the way American businesses are responding, religious communities across this country. The American people are coming together. They're responding with common sense, compassion, and generosity. People are heeding the advice of state and local authorities, and tens of millions of Americans are putting into practice 15 days to slow the spread. We are officially, Mr. President, 6 days into our 15 days. And as we look all across this country, while we strongly support the decisions that governors in states where we have significant outbreak have taken, we encourage every American to listen to those state and local authorities. For every American, this is what you can do to make a difference over the next week and a few days to protect your health, protect your family's health, but most especially slow the spread and the potential for the coronavirus to impact the most vulnerable. As the President said, we've almost been overwhelmed at the outpouring of support from American businesses. The President spoke yesterday to thousands of small businesses. We spoke to manufacturers yesterday, and in fact, as the President indicated, the FDA in record time just approved one manufacturer that will be producing millions of surgical masks in a matter of weeks for the American people. The pastors we spoke to, we want to thank all the religious leaders from every community of faith in the country, making the hard choice to suspend services, to have online services, even while those ministries are continuing to support food banks and come alongside the most vulnerable. And of course, the chorus of prayers that is coming up from communities of faith around the country is making the difference that it always has in the life of this nation. One thing the President and I promised was to remind people that on the weekends that you're not in the pews, it's still a good idea to, if you can, to go ahead and make that donation, because all the ministries are continuing to play a vital role in our communities, and we encourage your continued support. The President and I are grateful that the American people are listening to state and local authorities and putting into practice all of the recommendations in the President's coronavirus guidelines. As you will hear in just a few moments from Admiral Gua, testing is expanding rapidly across the United States of America. State-run drive-thrus are expanding across the country. And as you will hear detailed this morning, now more than 195,000 Americans and more who have been symptomatic have been tested. That number does not include county hospitals or healthcare labs around the nation, some 15,000 in number. And among the number of the more than 195,000 that have been tested, it's important to remember that only 19,343 at this moment have tested positive for the coronavirus. We continue to urge state and local health authorities to contact FEMA for all the latest developments and innovations in testing. But we want to remind Americans, as Dr. Fauci will emphasize in a moment, if you don't have symptoms, don't do a test. It is another way that the American people can make sure that we are preserving the resources that our healthcare workers need to minister and to support those who are dealing with the coronavirus and other illnesses. In a moment, Pete Gaynor will detail the efforts at FEMA. Since the President's national emergency declaration, we have FEMA in the lead, stood up the National Response Coordination Center, as the President said, and we are working closely, literally hour by hour, through FEMA, processing requests from states most impacted, like New York, Washington State, and California, and we'll continue to work very, very closely with those states through the very traditional means of federal emergency management at FEMA. Secretary Carson will describe decisive actions the President alluded to bring foreclosure relief to Americans. And on the subject of supplies, in a moment you will hear of not only the progress that we're making on testing, but on Monday we'll be detailing for the American people the progress that we are making on the President's strategy of procuring more personal protective equipment and medical supplies, allocating them through the system of FEMA, and continuing to urge conservation by Americans. In fact, I'm pleased to report to the President today that HHS just placed an order for hundreds of millions of N95 masks that will be being made available to healthcare providers across the country. On behalf of the President, we do renew our call for Americans to postpone elective medical procedures, including dental services. And remember, this is another way that you're going to make sure that medical supplies are available, because by postponing elective medical procedures, you're freeing up medical supplies for those dealing with the coronavirus. As the President mentioned, our team is on Capitol Hill as we speak, working with members of Congress in both political parties. They're making progress, by all accounts, on a bipartisan bill. They worked late into the night last night, started early this morning, and we are working to pass that legislation on Monday in both the House and the Senate. Now, on a personal note, many of you may have been made aware that a member of my staff has tested positive for the coronavirus. We learned of that late yesterday. I am pleased to report that he is doing well. He had mild cold-like symptoms for about a day and a half, has not been to the White House since Monday. Neither the President nor I had direct contact with that staff person. We worked immediately with the White House physician and the CDC. We've done all contact tracing. And while the White House doctor has indicated that he has no reason to believe that I was exposed and no need to be tested, given the unique position that I have as Vice President and as the leader of the White House Coronavirus Task Force, both I and my wife will be tested for the coronavirus later this afternoon. Let me say again how grateful the President and I are that every American has acted on the President's coronavirus guidelines. We are 6 days into 15 days that, as Dr. Fauci may well reflect in a moment, is an opportunity for us here on the footholds of this epidemic curve in our country to literally lower the impact in our nation and save lives. Every American can do their part to slow the spread, and we encourage you each to continue to do that. As the President says often, remember, we're all in this together. And also remember that for most Americans, the risk of serious illness from the coronavirus remains low. The reason we want to put into practice the President's coronavirus guidelines is because no American would want to inadvertently expose someone who is vulnerable, a senior with a serious underlying health condition, to the coronavirus with a potential threat. I did hear one story this morning, Mr. President, about a senior named Geneva Wood. She actually is at the Life Care Center in Kirkland, Washington. She is not only a grandmother, she is a great-great-grandmother, 90 years young, and she tested positive for the coronavirus on March 6th. But by all accounts, she's doing well. She wanted America to know there is hope, and her strength and her enthusiasm is truly an inspiration to the nation. As the President said many times, we're going to get through this and come out stronger than ever before. And we'll get through this as Americans together.
Thank you, Mr. President, Mr. Vice President. As I told you earlier last week, we are in the process and are effectively transitioning to large-scale testing by leveraging all the components of the American healthcare system. When we started, it was CDC only. Then it was the state public health laboratories. Now we're transitioning into the mainstream of American testing with many of the companies that the President invited in the Rose Garden just a week ago. So currently, 91 public health laboratories, state public health laboratories, are up and running in 50 states, the District of Columbia, Guam, and Puerto Rico. This is our curve, and I want to be very clear about this, that this only accounts for CDC, state public health laboratories, and the laboratories that are members of the American Clinical Laboratory Association. These are the main reference laboratories: LabCorp, Quest, Mayo, ARUP, BioReference Labs, and Sonic Healthcare. It does not account for the well over 10,000, 15,000 hospital-based labs, many of which are doing testing, for whom we will get data this week to give you an overall roll-up. As you can see, over 195,000 people in America have completed their testing. That means tests plus results. This does not count the people whose tests are in process. And as you see, this curve is going, it will continue to rise dramatically over the next period of time. So again, this is utilizing all the components of the great American healthcare system, the state and local public health laboratories, the hospital system, which is not represented here, and the main reference laboratories. Now, I do want to make it clear that although testing is becoming more available, and Dr. Fauci will definitely emphasize this more, there are priorities for testing. And clearly, everyone across the country should understand that those hospitalized or in an ICU are a priority for testing. Symptomatic healthcare workers, for obvious reasons, we want to make sure that their health is preserved and that they are not going to spread to those who may be seriously ill. Symptomatic people in long-term care facilities. As the Vice President has highlighted, and we've said many times, elderly in our society have a much higher mortality rate, much higher serious complication rate. Symptomatic individuals over 65, symptomatic individuals who have underlying conditions like chronic heart disease or liver disease or other types of chronic diseases, patients in public health investigations, and there are local priorities around the country, particularly healthcare workers for testing. And Dr. Fauci is going to emphasize this about the types of people who may not be to be tested. Testing is going well, it's ramping up, but we should still have priorities. Finally, I want to talk about the community-based testing sites. I know they're popular now because there's now an acronym, which I'm sure the Vice President doesn't appreciate, CBTS, or CBT sites. We talked about these earlier in the week, and I wanted to emphasize again that these are state-managed and locally executed. The federal government is there to provide support, know-how, blueprints on how to do this, but these are really springing up at dozens and dozens of sites all over the country, adapted to the local needs. Some are drive-throughs, some are walk-up, some are geared to healthcare workers and emergency responders. So again, what we see in the upcoming week is this curve will continue to increase as testing becomes more widely available, as the great American healthcare industry continues to increase the availability of tests and the throughput of those tests.
What I want to do just over the next minute or so is maybe connect some of the dots of the things that you've heard today. First, the status of the dynamics of the outbreak. I mean, you all know the numbers, you've seen them. We have widespread infection, but to varying degrees throughout the country. So, for example, when you talk about the kinds of mitigation issues that we have put forth and have emphasized, just as I mentioned the other day, there are two dynamic forces that are going on at the same time. You're having the natural course of an outbreak trying to peak at a high level, and then you have the mitigation strategies which are aimed at dampening that. We've mentioned that multiple times. We often get asked, how do you know you're having an effect? Because there are two things that are going on at the same time. They may be confounding. Well, I can tell you for sure, from a public health standpoint and experience with other outbreaks, we know we are clearly having an effect, but we can't quantitate it for you accurately now, because looking forward, you'll know what the impact of the rate of these steep inclines will be. So that's why we're going to come back to you every day and keep you up to date about that. Getting with regard to the disproportionate of the response, everyone, it's right here, I'll open up the Vice President's book with his permission. This is baseline for everyone. In other words, throughout the country. But then there will be areas, and you've heard them, Washington State, California, New York City, in which the dynamics of the outbreak are clearly different and much more robust, if you want to use that word. And that's the reason why we've seen the mitigation ratcheted up in that regard. And again, hopefully, and I have confidence it will happen, you will see an impact on that. Next, getting to testing. You saw the numbers with testing. Remember, there was always an issue with testing. I think we're getting to the solution that everybody in the country is looking for. But I want to emphasize one thing that Admiral Giroir mentioned, is that not every single person in the United States needs to get tested. He gave you the priorities. I don't want to repeat them. But let me tell you one of the unintended consequences of individuals who don't need to get tested that flood the desire to get tested. Currently, and I hope we'll be able to change it and make it much less reliable on PPEs, when you go in and get tested, you are consuming personal protective equipment, masks and gowns. Those are high priority for the healthcare workers who are taking care of people who have coronavirus disease. So what we don't want to do is to have a situation where we do have disparities in availability of PPEs now, and we're working hard to correct that. But currently today, we want to make sure that the people who are taking care of people with coronavirus disease do not endanger themselves because they don't have the personal protective equipment. And then finally, one last thing was just mentioned. The Surgeon General has been pushing this. Please put off, cancel elective medical and surgical procedures. You don't want to not ever do them, but for the time being, don't do them, because they also not only consume personal protective equipment, they may also consume some of the things like ventilators that you might need. So let's pull in this together, and we will get through it. I promise you. Thank you.
Thank you, Mr. President, Mr. Vice President. FEMA is now leading the federal operation or the federal response for all operations on behalf of the White House Coronavirus Task Force, who oversees this whole-of-nation response. HHS will continue to provide their expert matter expertise on health, and pursuant to the nationwide emergency declaration, FEMA, in coordination with HHS, is assisting state, local, tribal, territorial governments and their other eligible entities with health and safety emergency protective measures on behalf of the American public. As of yesterday, 50 states, the District of Columbia, 5 territories, and 1 tribe are working directly with FEMA under the nationwide emergency declaration for COVID-19. In just 24 hours, we've obligated $100 million to states, territories, and tribes. A little bit about supplies. It is of the utmost importance that requests for assistance, especially for critical supplies, get routed through proper channels as soon as possible. And we ask everyone to follow the normal procedures FEMA uses in a natural disaster. There's no different procedure for the COVID-19 pandemic. But remember, you can still order supplies from your regular vendors and buy it on the open market. Buy it where you can find it. We will reimburse you. If you buy medical supplies from foreign sources, it is reimbursable. Buy America does not apply to the Stafford Act, except for Washington, D.C. and Puerto Rico. If you can't buy it on the open market, make a request through the FEMA system. Requests for assistance at the local and county level should first go to states, from states to the regional FEMA offices, and then from those offices right here in D.C., where the National Response Coordination Center is open and running. We are getting requests for masks, PPE, swab sets, test site supports, ventilators, hospital capacity assessments, and many more. We are in lockstep with HHS to answer these requests, but we will do whatever is necessary to get states, tribes, territories, and others what they need. And then finally, what we are doing here in Washington, D.C., again, this is a whole-of-government response. Like all emergencies, response is most successful when it is locally executed, state-managed, and federally supported. We can't say that enough. On Thursday, our federal partners fully integrated with our National Response Coordination Center, and additionally, all 10 FEMA regions across the country have been activated. The FEMA regional administrators will continue to coordinate closely with governors, state emergency managers, state public health officials to determine the type and level of support needed to respond to this dynamic threat.
Thank you, Mr. President and Mr. Vice President, for your tireless leadership here. And I also want to thank the fellow task force members who have been working around the clock in a very patriotic way to serve their fellow Americans. You know, part of the American dream is having a home. And sometimes people say, well, what does housing have to do with health? It has everything to do with health, having a safe home. And that is the reason that the President has authorized the immediate cessation of foreclosure and eviction proceedings for American citizens, single-family forward mortgages, as well as reverse mortgages. And as you know, FHFA has also decided to do the same thing for 60 days. And the CFPB is very happy with all of this as well. And it's really all about helping our people, recognizing that they're being severely impacted by the coronavirus. And we've also asked the various servicers of mortgage loans to exercise forbearance for anybody who's having difficulty. It is important, if you're having difficulty, to actually contact the people who have made the loan, who established the mortgage, because it doesn't happen automatically. What does happen automatically is that we cover all 8.5 million people in terms of the moratorium on foreclosures and evictions. We want also for the PHAs to be protected. HUD does not have authority to mandate that evictions can occur, but we are in contact with all the PHAs across the country and are petitioning Congress for the power to be able to actually enforce that. But the fact of the matter is most of the PHAs are run by people who actually care about other people. So we really haven't seen much of a problem there. We haven't seen much of a problem with forbearance and needing to try to force people to do it because they want to do it. People are stepping up and saying, what can we do to be helpful? As far as housing choice vouchers, Section 8 is concerned, the April vouchers will be sent out next week. In May, vouchers are already being worked on. And we're also staying in contact with all the stakeholders, the advocates for low-income housing, as well as other stakeholders to make sure that we're doing things that are most helpful to them. And additionally, we've extended the deadlines for healthcare and multifamily financial reporting requirements. And that's for over 20,000 multifamily and healthcare borrowers until April the 30th. And that provides them with a lot more flexibility to deal with the issues that they're dealing with. I also want to thank our FHA Commissioner Bryant Montgomery, as well as the FHFA Director Mark Calabria, and Kathy Kraninger, the Director of CFPB, who've all worked tirelessly with us to make this happen. What we're trying to do is bridge the gap, recognizing that it's a lot easier for us to take these measures and for Congress to take the measures that they're taking so that we don't destroy a very excellent system and have to start all over again. So for those who are worried about the money that's being spent, if you don't spend the money and deal with this now, it's going to cost a whole lot more to try to build all this up again. And as was mentioned by the President, there's been a sense of unity that we haven't seen for a long time in this country. And let's hope and pray that that unity lasts far beyond this crisis.
Mr. President, a few questions, if you don't mind, sir. If you've lost your job now, or you're worried that you're going to lose your job tomorrow, restaurant, something like that, what do you want people to do immediately? The second question, sir. We heard from the Vice President that he's going to be tested. Have you taken a test since last Saturday? So for those people that have lost their job already, or they're worried that they're about to lose it tomorrow, what do you want them to do right now?
Mr. President, on your Defense Production Act power, one of the features of that is that the federal government would be able to control the output, whether it's masks or ventilators, get it to the most areas of need, and control the pricing to keep it at a market level so it's not price gouging. One of the things we're hearing from governors, they can't find supplies and prices have gone up. So you've talked about the act, sir, but you have not yet compelled any companies. Why not? Direct them to the places in greatest need. And this happens for a governor who needs equipment today.
Mr. President, forgive me if I heard you wrong at the beginning, but you said something, we are going to be going over to the Hill. Are you going yourself to? You're asking Congress to essentially pass a series of legislation that's going to amount to about $2 trillion, 10% of the GDP. What do you say to members in both parties who say, this is too expensive, this is just too much, to debate and get done in 48 hours or so? And also, have you spoken directly with Speaker Pelosi at all about any of this?
On the subject of masks, the Vice President announced HHS was ordering hundreds of millions of them. Was that order just placed today? How is that going to be distributed, and when can doctors and nurses expect to actually receive those masks?
Yeah, HHS is completing a $500 million order of N95 masks, and all of this is being coordinated through FEMA, and we are responding specifically to state requests where the needs arrive. As Dr. Fauci said, we want to make sure the people that are providing healthcare services to people who may have contracted coronavirus have the protection to keep themselves and their families healthy. But I want to emphasize the supply of so-called N95 masks has been vastly increased in the country because the president insisted that we extend liability protection to industrial masks. What all the experts told us early on was that industrial masks that are used on construction sites, the president's very familiar with from his past life, are perfectly appropriate to protect healthcare workers from respiratory illness. But they didn't have the liability protection because they weren't created for hospitals. We worked with leaders in both parties. We added that protection that runs through 2024, that now the industrial N95 masks can be purchased by hospitals, purchased by states, purchased by HHS, and distributed through our system. So we're making those available. The supply has been, as I said, vastly increased, and it was another step forward and a bipartisan accomplishment. And we're continuing to use all the kind of creative means of American industry to make sure that we're leaning into this effort and that we do whatever it takes to make sure that our healthcare providers have the protective
We
equipment.
are still
they need.
hearing from doctors and nurses about this shortage. When exactly can they expect to receive these masks, though?
Well, let me let Pete Gaynor speak to that, because FEMA will be, HHS is now fully integrated into FEMA, and so as the requests come in, but obviously, as I'm sure the administrator will say, they're being prioritized to those areas with the highest need. Pete?
So within the National Coordination Center, we have a supply chain task force. And in basic sense, we're trying to identify the universe of what's out there. So whether we hold it at the federal level, we hold it in the private sector, and then match that up with demand and asking people to be creative. We're asking, again, this is a shared responsibility. We're asking locals and states to do your share locally, try to take a little bit of burden off of us, and then we'll prioritize those scarce resources, because every single governor across the country is looking for the exact same thing. So there's a balance, but we're examining the entire supply chain. They're out there now. So again, we want to match, we want to get out of the middle. So we're trying to match suppliers with demand. So that's what we're doing right now. It's happening today.
They can expect them today, or they're matching supply and demand?
There's a range of requests across the country, and we're trying to match those, again, supply and demand every day.
Are you
through the
satisfied
task
with that?
There are CDC guidances about how you can minimize the use of masks by different things that you could do with testing, and when you have masks, how you might reuse them, which ones you can reuse them.
Do you think there's a solution to this other than buying more masks? Do healthcare providers need to change how they're using them?
Yeah, well, there are a couple of things. One, for example, we are moving towards getting testing where you don't have to have PPE. I mean, I'm not going to tell you the day it's going to be there, but it's going to be a swab that you could stick in the nose of the person who is either infected or not, but that person doesn't need PPE, the person who's administering the test. So if you could do a self-administered test, stick it in a vial, hand it over. You don't need a mask, you don't need PPE. That's one of the things we're trying to do.
May I? And this is another story about great American industry. I mean, the president and I literally heard directly from Apple that they're donating 2 million industrial masks to this effort around the country, and working with our administration to distribute those. And it might be a good opportunity for us to renew our call as the president and I delivered this message to businesses yesterday, manufacturers and small businesses. It's a great time to go to your storeroom, and if you have N95 masks, if you've got 100 of them, if you've got 10,000 of them, is to load them up, drive them over to your local hospital. That story is literally happening all over the country. And now with more Americans stepping away from elective surgery, including elective dental care, we're urging dentists around America to look at their supplies of N95 masks and make those available to our hospitals. But the great news is, as the President said, the American people are all doing this now. So allow me to say on behalf of the President, thank you for what you all are doing today, but we want to encourage people in business, encourage people in dentistry in particular, look at those supplies of N95 masks, pack up as many as you can spare, drop them off at your local hospital. It'll be a great service to the country.
I just want to read you some of what some of the doctors on the front lines of this crisis are saying. These are doctors who are talking about the shortage of medical supplies that they are facing. Dr. Faiza Bucks in Kentucky says there's absolutely no way to protect myself. A surgeon in Fresno, California says we are at war with no ammo. Dr. Mel in Illinois says if this is a wartime situation, then now is the time to act. I know you're talking now about increasing production at so many of these facilities to get the masks out. But given that this is one of the wealthiest, most powerful countries in the world, should this even be happening? Shouldn't this have been resolved weeks ago?
I'll tell you,
Mr. President, it's been nearly 3 months since your administration learned about this virus.
I'd just like to address that for a moment. Again, I'm an ICU physician, ran health systems, and I first of all want to thank everyone who's on the front line in the emergency room, in the ICUs, in the hospitals. I speak to my colleagues daily. We need to preserve our PPE to the degree that we can. CDC guidelines has had that. The President has talked about it. But I also want to say we are making product, as the President said, but we are also responding through the FEMA system to distribute the strategic national stockpile resources according to requests that come in. Stockpile has been distributed to many states, first orders, second orders, and on a daily basis adjudicating that. If there are shortages in your hospital system, I can't tell you of Dr. X, Y, Z, that needs to be clearly iterated to the local emergency management.
Are you seeing those hospitals talking about the
We
shortages?
were on the
asking federal
phone 2
government?
nights ago or 3 nights ago with over 2,000 hospitals or hospital systems sharing best practices from Seattle, where they've been very innovative, pioneering some of these areas. When there is a shortage, they need to go through their emergency management. It goes directly up to the FEMA system, which really rocks. It really works very, very well. And then there's a distribution of the stockpile. Now, the stockpile isn't infinite. That's why it's being replaced by all the orders. But mask supplies go out on a daily basis as they are needed and requested through the FEMA system. And I don't know, Administrator Gaynor, whether you want to add to that.
Just to reiterate what Brett said, we don't take lightly what you just read. You know, I mean, I get the calls every night, the way you get emails. It's a serious issue. We don't want that to happen, but it is happening. You're not making things up. I know that because I'm experiencing myself. But what you just heard about the different avenues, some of which aren't even recognized about how you can get help through the FEMA process, in addition to the large amounts of additional PPE that's coming into the system. We hope that very, very, very soon, we're not going to get those kinds of real-life difficulties.
Matter of weeks? Again, it
Yeah.
seems like there's a question about the timeline here,
Yeah.
and even FEMA can't quite answer what the timeline is. Days, weeks. You know.
Yeah, sooner than weeks. It's going to be days, I would hope. You know, we're going to try to make it days to the best possible way we can.
Yesterday, there were questions about the use of this malaria drug. Have those questions now been resolved?
Mr. President, on the economic front, there are reports that the coronavirus is really hurting your businesses, especially your hotel. Did you or anyone in your administration talk to anyone at the Trump Organization about the potential effects of the coronavirus?
You no longer go to Mar-a-Lago or Benton.
Do you expect your family company to seek government assistance if it's eligible?
Mr. President, as you know, we've been talking a lot about masks. We've also talked about how not everyone needs to take a test. What about a temperature test? As we know, we all came into this room and got tested before we entered. Should they be on a mass distribution basis too?
I mean, they have a place. They're not infallible. I mean, there's so many ways to get around that. I mean, right now, every time, certainly here, every time I go into a different room, I get my temperature taken. But we see that on the outside, that some people, There is a role for it under certain circumstances. What I don't see is a massive distribution of thermometers that are going to actually have a major impact on what I showed, what we need to do.
This morning, the Washington Post ran a story suggesting that you delayed taking action on the virus in January and February. Dr. Fauci has indicated that your action in the Chinese travel ban helped America immensely. What do you say to the Washington Post?
So a number of the states have kind of done these different measures. We've seen California order one
Yes.
thing, New York, just be similar. Do you want all of the states to do one uniform rule, sir, so people can't leave their homes? That certain businesses that are. You don't want all of those to be the same.
We're day 6 into your 15 days of recommendations.
Yes.
A lot of people are following them. Some people are not.
Yeah.
Do you think the American people are doing enough right now to slow the
I
spread?
think
A number of groups are calling for the postponement or cancellation of the Olympics. Have you given him third?
No, I have.
Since this story keeps popping up, when did you first learn that this was going to be a problem?
Can I follow up on that?
Yeah.
Because as you were saying, China was extremely secretive about this. Several of your advisors have been warning, have been critical of China. Secretary Pompeo was talking about it yesterday, and he had been saying so for quite some time. So why then, on January 24th, did you tweet that China has been working very hard to contain the coronavirus, that the United States greatly appreciates their efforts and transparency?
Because
it will
it's
all
true.
work out well.
Because
Why were
it's
you
true.
saying that?
Are you able to share, thank you for the numbers on the testing, by the way, are you able
Thank
to
you.
share any other hard numbers on number of available tests, on number of ventilators in the federal stockpile? The 500 million masks, they're due for delivery according to HHS within 18 months. The last number on ventilators we had was 12 to 13,000. Can you give us an updated number? Do you have numbers to share though right now? Do you have numbers to share with us right now? On stockpile?
Mike, go ahead, please.
Yeah, you bet. Well, we've spoken a lot about masks this morning, but the president's also given the task force a priority of assessing the availability and expanding the availability of ventilators. And on Monday, we will detail some very encouraging news for Americans. You speak about the number of 13,000. It is a little more than that we have in the national stockpile. But it's important to remember that that doesn't include the more than 100,000 ventilators that are in healthcare facilities and hospitals around America today. It doesn't include what will be produced, as the president said. We're seeing companies step forward. These manufacturers tell us that a ventilator actually isn't a very complicated piece of equipment, and many of them are literally surging forward to create more ventilators. But one of the more exciting developments in the last week, which we'll detail more on Monday, is that in the president's engagement with our healthcare community, we learned that ventilators that are currently used by anesthesiologists, that are used in outpatient clinics and in other procedures, can be converted to be used as ventilators for people struggling with the effects of the coronavirus. We've confirmed that a particular screen in that device can be changed readily. We're working with the FDA to approve that. But again, it's a great testament of the American people and our healthcare professionals that are stepping forward and bringing ideas forward that literally, as we'll document Monday, will increase the supply of ventilators by tens of thousands. But look, the president's made it clear. We want to make sure that all the incredible, courageous men and women who are serving in healthcare around America have the support they need, that our patients that are struggling with recovering from coronavirus have the equipment they need. And we'll have a lot of detail on Monday as we continue to assess
8 days ago that
what's
we would
available.
have 1.4 million tests on board by the end of this week, by today. Do we have that? Can you give us the number that we have?
Let me let Admiral Goss speak to that.
Thank you.
So I'm going to answer your question and then try to persuade you to stop asking about a specific number, okay? So from March 2nd to March 14th, we have put over 10 million laboratory tests into the U.S. commercial market, and we expect that by March 28th to be well over 27 million into the market. So that answers your question, and let me tell you why it's not the right question. Not every lab can run every test. Not every test is completely self-contained. So the more important question is not how many tests are in the market. We got them in the market, but it's to make sure that every segment of the market has the kind of test that they can use.
Admiral, we're using your numbers, trying to find out for the public if the things you've promised are happening.
Yes, they are happening. They are we promised 1 or 4 million. There's 10 million tests in the market
And
now.
are the masks that are in the strategic reserve being deployed, Mr. Vice President?
Yes, the masks in the Strategic National
So
Stockpile.
it's not 13,000 anymore, it would be a lower number, would that be fair to say?
Masks are.
No, the ventilators. I'm sorry, the respirators. Thank you. We're trying to understand if the things we have been told sitting through these briefings for many days are happening and getting into the hands of the healthcare providers.
How about back here?
Mr. Vice President, the military has sent planes to Honduras, Morocco, and Peru to pick up Americans and bring them home who have been stranded there. But there's still a lot of other Americans who are stranded and can't get home. So does the military plan to send planes to pick those folks up? Where will those planes be going? When will they be going? And can you assure Americans that who are stranded in foreign countries that they will be able to get home?
Well, we received a briefing this morning from the State Department about their efforts. And we want to be very clear. While the President has suspended all travel from Europe, including the UK and Ireland, suspended all travel, of course, from China since January, that any American who can get home can come home. They'll go through additional screening that's all been implemented and is working in an orderly way at a number of airports around the country. But there are instances, Morocco being among them, where there simply are not flights to get home. Our State Department has been working very closely with our embassies in those relevant countries. I was told this morning that all the way going back to bringing Americans back from China, that we have made individual efforts to bring home about 3,000 Americans. I think there is an ongoing effort to address that with chartered commercial flights that the government is providing. Obviously, also military transport is available, but our task force received a briefing this morning, and we would just encourage any American that's looking on from overseas, contact the local U.S. Embassy, let them know about your circumstances, and know that we're going to continue to work very diligently to get our Americans home.
All right, guys, last question.
Two quick ones, education and a medication one. You guys have announced that standardized testing is essentially canceled in this country. To the tens of millions of students out there, their teachers and their parents who are sort of scratching their head wondering, well, what does that mean? Obviously, a lot of this is driven by local school districts, by the state. Is there any federal guidance on this? And if not today, could you have Secretary DeVos or somebody come and explain that to the millions who are literally sitting at home, trying to figure out what exactly that means?
Well, I think it's a terrific question, and we will bring Secretary Betsy DeVos here tomorrow or on Monday to address our efforts. The objective here was as people are embracing the President's 15 days to slow the spread, we have decisions by local school boards and local and state officials that have canceled school or suspended school for a time. And we wanted the Federal Department of Education to make it clear that the burden of standardizing testing, which back in my days as governor, I remember takes a number of days and sometimes up to a week to administer, is not going to be placed on schools. But we'll have the Secretary here to address that very specifically, and it's a very good point on your part.
I mentioned I had a medication question, and I wanted to ask it while the President was here, because earlier he tweeted that there were two certain medications that when taken together, quote, have a real chance to be one of the biggest game changers in the history of medicine, and that they should be, quote, put in use immediately. Since he's not here, I can't ask him what he meant, but I'm wondering if Dr. Fauci or the Admiral could clarify if you have any sense of what he was talking about, and whether his 74.5 million Twitter followers should be taking medical advice from him or from someone else.
The President brought together the top pharmaceutical companies in America and in the world a number of weeks ago. And they formed a consortium to work on a range of responses, beginning with therapeutics, which for a layman like me, that just means medicine to make you feel better. They're already going to work on that. We actually think, Dr. Fauci, I think there's some sense that that our great pharmaceutical companies may actually be producing therapeutics that will give relief to Americans struggling with coronavirus as soon as this spring. We also challenge them to work together as rapidly as possible to develop a vaccine going forward. And as Dr. Fauci has indicated, we brought a vaccine to clinical trials now the better part of a week ago, the fastest time in history. Now, it's the first phase of the trials, and people should understand, as our health experts have described, that there'll be a period of as much as a year and a half before we can make those vaccines available. But as the President said at this podium, there is some anecdotal evidence that several existing medicines may have brought relief to patients struggling in China and in Europe. And the President has tasked the FDA to work very rapidly to allow what's called off-label use for those. One is a malaria medicine. But this morning, I think the President reiterated the hopefulness that he feels about this, that because these are medications that are time-honored and tested, they've been taken for many, many years, that we want to pursue, number one, making those available if someone's doctor believes that it's appropriate. The doctor would be able to prescribe that medicine even though that's not indicated. That's called an off-label use. But the other piece is, as Dr. Fauci said, and I'll yield to him, in deploying those medicines, we're working specifically with one state to do so in a way that represents a clinical trial. So it would not just be compassionate use, which the medicines are already being used for in some jurisdictions today, but also we could study it and determine the viability of it. And in fact, we're working diligently right now with that supply chain to make sure that those medicines are available. Dr. Fauci, did you want to speak to that? Sure.
You know, it's essentially what I said multiple times from this podium, is that when you have, first of all, we're trying to develop de novo drugs that are not yet out there, not approved, that ultimately would be effective. And the way you prove that is to do a randomized controlled trial to prove safety and efficacy. I'm not totally sure what the President was referring to, but I believe he's referring to a report that used both hydroxychloroquine and azithromycin together to have some possibility of being in effect. Many of the things that you hear out there are what I had called anecdotal reports. They may be true, but they're anecdotal. So the only thing that I was saying is that if you really want to definitively know if something works, that you've got to do the kind of trial that you get the good information. The President is talking about hope for people, and it's not an unreasonable thing to hope for people. So when you have approved drugs that physicians have the option in a decision between the physician and the patient, are you going to use a drug that someone says from an anecdotal standpoint, not completely proven, but might have some effect? There are those who lean to the point of giving hope and saying, give that person the option of having access to that drug. And then you have the other group, which is my job as a scientist, to say my job is to ultimately prove, without a doubt, that a drug is not only safe, but that it actually works. Those two things are really not incompatible when you think about that, particularly when you're in an arena where you don't have anything that's proven. We went through the same sort of thing with a little bit of a different twist during the HIV/AIDS epidemic until we finally developed drugs that were absolutely knockout drugs that were safe and that were effective. But in the beginning, there was that tension about that. So you really got to have a balance. I've got to do my job as a scientist, and others have other things to do.
Great.
Mr. Vice President, question for Dr. Carson? Yeah, question for
Let me just, if I may, let me just say, I hope this morning has been informative. We will be back again tomorrow. And I hope the American people are encouraged because of the incredible whole-of-government approach, because of our collaboration with states. You're seeing testing expanded all across the country. That incredible public-private partnership with commercial labs is now making testing available by the tens of thousands. We're working very diligently with an incredible response from American industry to make sure that personal protective equipment and ventilators and all the things that our healthcare providers need to meet this moment is there. But let me just say again, what every American can do today. And that is, first and foremost, heed your state and local authorities. There are individual states, California, Washington State, and at this moment, especially New York, that have issued guidance to their citizens. And as the President said, we wholly support the leadership that those governors are providing in their states. But secondly, every single American can put into practice the principles of our 15 days to slow the spread. The President's coronavirus guidelines, as I said, we're 6 days in, and the purpose of these is not because every American is at risk of serious illness. As we said before, all our experts tell us, all the data shows, that the risk of serious illness to the average American remains low. But because the coronavirus is, we think, 3 times more contagious than the flu, to slow the spread, to literally lower that curve and spare Americans around our country with being exposed to or contracting the coronavirus, or worse, every single one of us can put these principles into practice. I recommend that you go to coronavirus.gov, sit your family down, call a neighbor and a friend, support efforts in your local community to put these principles into practice. And as people all across this country continue to do just that, I just know we'll get through this, and we'll get through this together. Thank you all.